has to make sure.
Hello and welcome into this week's edition of AFMC TV. We're glad you're joining us today. Joining me now is Dr. Kristy Bondurant. And Kristy, you are our staff epidemiologist here at AFMC.
Absolutely, yes.
And so, of course, we've had you on before, but I'm real curious. I'm excited about this topic because we are talking about the renewed emphasis on public health. There's always been public health, this isn't anything new, but it seems like a spotlight maybe was really shown on it as a result of the pandemic.
Absolutely. And like you said, it's been around for a while. In Arkansas, our Board of Health was established around the late 1800s, early 1900s, and it was focused on an infectious disease initiative at the time. And so much like what you just experienced with the pandemic. And so that emphasis, it doesn't just focus on infectious disease, though. We have a lot of different public health programs in the state, whether those are, food and water safety, if we're looking at oral health, maternal and child health, and even just surveillance. I know we talked a lot about data during the pandemic.
We did.
And we have a great data science team here who also, a lot of the programs that we work on, they focus on public programs, on health programs, and looking at whether those are effective, if the population that is intended to serve is served, and how that service has gone. And so we do that through evaluation and surveys on a regular basis. So it's something that AFMC is used to. We did a lot of work during the pandemic through, contact tracing, case investigation, vaccines and testing. But we also, have a long history as well as a company of working on public health programs.
I like that public health just as a whole, to someone who is not medical, encompasses so many things. As you were mentioning, it's not just infectious disease. It's things we might not think about, such as maybe food insecurities. Yeah. Okay. So I know here locally we've heard the term community health worker, and that may be a term that some who are watching might be familiar with or may not be. So can we start first by defining what is a community health worker?
Absolutely.
What's that focus?
Yeah, so a community health worker is that frontline public health worker. They're engaged and embedded in their community and the community that they serve. They are also a trusted member of the community. And so they serve as a link or a liaison between health and the community members. They're there to educate. They're there to link individuals to service, to health services. They really are a critical piece of several different types of public health programs.
So in general, they are that link.
Exactly.
And we've got community health workers all across the state of Arkansas?
We do. They work on various programs. Many of them serve the types of programs that I mentioned earlier. The ones that we're working with directly, they're working on a vaccine hesitancy program, trying to reduce vaccine hesitancy in the state. They're a very engaging group, very enthusiastic. We've serviced several different counties through the program that we're working with. We're partnering with UAMS on this project, and their main focus and the work that they're specifically doing is to engage their community and encourage them to go to vaccine clinics, and we're providing those vaccine clinics as well.
Are community health workers medical individuals?
No, actually, they're lay people. And that's one thing that I think is kind of confusing about the name. You might think that they need to be, have a background in biology or in healthcare itself. But that's something that we can educate them on, and we have. A lot of our community health workers that we're working with right now served in our pandemic response efforts. But we retrain them to help them with the tools they need to be able to engage their community, to communicate and educate for these vaccine efforts that we're doing. and they're doing an excellent job. It's really great to see their enthusiasm, and that's one thing that is that we're looking for. We're looking for people that have a network, that are willing to use that network to educate, who are passionate about the programs that they serve. It's not just, got to have a degree in biology and then get you out the door.
So you don't have to be an RN or an APN or retired or anything like that. Just having that passion and wanting to be able to serve is really
absolutely
the qualities that are needed. Have there always been community health workers?
Yeah, in a way they have. They go by a lot of different names. And I think that's why maybe if you haven't heard of community health worker before, it's because maybe you haven't heard that name for that specific. But they've also been called community navigators. They are community liaisons, health coaches, public health aides, care connectors. And they can be a part of lots of different entities, lots of different companies or programs. So they can be, obviously through the public health system, but they can be a part of a clinic or a hospital, engaging and connecting that hospital or that clinic to their community that they serve. They can be a part of nonprofits as well as other state agencies. So they really can be a part of a lot of different programs.
And they service such a need too. Absolutely. that we're really seeing now, I think more than ever. Can anyone utilize the service of a community health worker if they don't know where to turn to or where to go?
Yeah, they absolutely can, because one of the big roles that a community health worker has is to connect people with services. So anyone that has a food insecurity, like you mentioned before, or a housing need, our community health workers, not only those that work for AFMC, but throughout the state, they have those connections and those links to programs in their community, services in their community that can help support those individuals. So yes, anybody is able to use a community health worker.
It's a great resource. It's great to know that they're out there. Kristy, is there anything else that you would like to add?
I think we covered quite a bit today. I do want to say that our teams, we're so incredibly proud of what they're doing right now. We've gone through the pandemic with them. They are working in their communities. They are very engaged and supporting and just doing incredible and amazing work out in the communities they serve. So, outside of that, just thrilled that they're here and working with us.
We've all been through a lot together, and there's a special bond with some of those who have weathered that storm with us, for sure. Exactly. For sure. Kristy, Dr. Bondurant, thank you so much for coming in.
Thank you, Michelle.
Joining me now is our president and CEO here at AFMC, Mr. Ray Hanley. Thank you for coming in the studio.
Well, thank you for inviting me, Michelle.
We've been able to get you in a couple of times over this last year.
Always a pleasure.
Thank you. We always enjoy having you. So I want to talk to you about the state of healthcare. Mm-hmm. And I'll first ask you to dust off your crystal ball. Healthcare just came through arguably one of the most difficult, strenuous, unprecedented season in modern times. What do you think might lie ahead, or what are some takeaways from what we've just
Well, I think
weathered?
the system bent, but it didn't break. The hospitals were terribly strained, big and small.
Yeah.
They got through it. I think the public health folks, the health department, governor's office, AFMC, everybody pulled together, I think. We certainly were out there in the vaccination testing business.
Yeah.
And I think we've gotten through it. I think hopefully we have learned a lot. If you look at the recent numbers, COVID tests, positive tests were up, deaths are way down, hospitalizations are down. I think we know the vaccines have made a big difference. I think we have come out of this with a real appreciation for staff, healthcare professionals, particularly nurses, which we're going to need a lot more of, I think, in the years to come. But the good news is we came through it.
You make an interesting point that I hadn't really thought of. It hadn't occurred to me. The system, the healthcare system itself, it bent almost into a pretzel. but it didn't break.
No, it didn't. And particularly in Arkansas, it excelled. It came through. Everybody pulled together.
Yeah.
AFMC, the physicians, the hospitals, the health department, the governor's office, and we got through it.
We did. And we're stronger, much stronger for it and ready for the next pandemic.
We are more ready than we were going into this one, I hope.
More ready than maybe we were in 2018, right? 2019. So changes to Medicare as a result.
I think the biggest change and the most lasting change is the use of telemedicine.
Yes.
Both its acceptance by the patients, by the providers, by the payers. And I think particularly in a rural state like this with transportation challenges and provider shortages, I think telemedicine is here to stay, and I think that can do an enormous amount to improve the way Medicare patients access care more timely.
Mm-hmm. You know, the pandemic also kind of put a renewed spotlight on public health.
Yes.
How do you think the perception of public health has changed, or what's the perception now moving forward?
I think before the daily briefings for most of the year by the governor and the director of the health department, I think the general public didn't really know much about the health department. I mean, some people knew they went to get their vaccinations for their kids, but it was sort of out of sight and out of mind. And I think after seeing it on page 1 of the paper for a year, the stats, the press briefings that the governor ran, I think it is much more in the front and center of people's minds. And I think and hope that they appreciate what they saw happen over the last 2 years, the leadership from public health in this state, from the governor's command of it to Nate Smith, to Dr. Romero, to Dr. Delahaye, who are out there every day on TV, on radio, and on page 1, helping people through this.
Let's look back and talk a little bit about what AFMC did, AFMC's role, because we were frontline as well.
We were chosen early on to step out and help with the contact tracing, with the case investigations, then vaccinations, then the phone center work. We were doing everything COVID related. And
still are.
Still are.
Today.
We're out there now. We haven't quit. We're still doing what we're asked to do, particularly by the health department. And I couldn't be prouder of the team here. We had, at the height of COVID, we had as many as 700 employees. Most of them working from home with headsets and computer monitors. We served literally thousands upon thousands of patients. And I think our team really, really shined.
And we embodied Arkansans helping Arkansans.
You bet. And we had employees working statewide, either on the phones, in the clinics, up in Searcy, serving the ice cream factory, the TV dinner factory when the shifts changed. We vaccinated, I think, 700 people one day in Searcy. It was really something to be proud of.
Yeah, absolutely. And led to new relationships in the business community as well.
That's right. And I think AFMC got a lot of notice, which led us to partner with folks like Baptist Health, do work with UAMS, because people noticed AFMC was out there and that AFMC was getting the job done.
That's right. So I'm curious, as the show itself is nearing its year anniversary, you have a little bit of news.
Well, I do. I think it's not commonly known, outside of the company here, but I am slated to retire the end of August after 12 years at the helm here.
Take me back over those 12 years. How have you seen AFMC progress, transition, grow up, mature into what we are
It has
today?
grown in terms of employees, in terms of the portfolio of customers, certainly in terms of contracts, revenue. We've doubled the size of this company in the last 12 years. We have retained virtually all the business we had. We added new customers. We added enormous new scopes of work, like our call service center. We've added work in places like New Hampshire and Wyoming and Minnesota. And then obviously we were positioned to step up when COVID came. And it is a much larger, much stronger, much more diversified company than we collectively started with a dozen years ago. And it is because of the team, that we have built here that excelled. And I'm very proud of the team that the board has let me assemble, including people like you. And I'm just really pleased.
When you look back over those dozen years, is there one defining moment, one moment that really sticks out, that maybe even is a sense of pride, that we did that on my watch?
It's several things. It's keeping the renewed trust of the customers. It's renewing existing contracts, but then it's big things like seeing the service center stand up, a whole new line of business with a couple of hundred people doing a variety of work for DHS and the health department, training people to sit there with those headsets, take the calls, make the calls, help people in all 75 counties navigate the health system. And then, of course, COVID, which was an enormous challenge and one we were picked to be out there on the front lines, and we got the job done.
Very good, very good. Anything else? Anything else you'd like to share with us?
No, other than, I've been in this health and public service business now for more than 40 years, and I capping this off with being able to lead AFMC a dozen years. Whatever I do or don't do next has certainly been the highlight so far.
Any immediate bike rides you have planned once you have officially retired?
My plan, since I'll be unemployed at least for a while, for the first time in almost 50 years, is my wife's going to drop me and my bike off in northern Minnesota at the headwaters of the Mississippi River, and I'm going to take a month or so and ride to the Gulf south of New Orleans.
All right.
So that's my plan, and then I figure by the time I get to New Orleans, I'll know, if I need another job or if I need to do what I want to do next.
Or turn around and bike back up.
Probably not that,
Okay.
Anyway.
Well, thank you. It's been a privilege to be under your leadership, and even just for a short amount of time, and see all the marvelous work AFMC has
You
done.
have contributed to that mightily.
So
Thank you.
And thank you so much for joining us. We will see you back here next week for more AFMC TV.